Today, I would like to give you the pros and cons, put some facts forward, and also discuss a little bit on my preferred dosage for the prophylaxis of COVID-19 by using ivermectin. But first, what is ivermectin? Ivermectin is a very old drug which was discovered in the 1970s in Tokyo, Japan, in the Kita Soto Institute. It was known as one of the three wonder drugs at that time, besides penicillin and aspirin. It has also won the Nobel Prize for Medicine in 2015. Ivermectin was first used successfully in treating worms and parasites in animals. Towards the late 80s, it was adopted for use in humans. It was similarly used to treat parasites and worms, most widely used in Africa. It was used to treat intestinal parasites and also the filariasis worm. So is there a difference between the ivermectin used in humans and animals? Yes, there is. Essentially, it is the same drug, but the ivermectin meant for veterinary use has more impurities than the ones for the human use. In the early days of COVID-19, ivermectin and also hydrochloroquine was used for the prevention and also for the early stage treatment of COVID-19. However, subsequently it was proved that hydrochloroquine is not effective in COVID-19. Ivermectin is known to have anti-inflammatory properties, but it has also shown some antiviral properties. It is known to bind to the receptor sites where the spike protein of the SARS-CoV-2 virus attaches. Today we are going to concentrate only on the role of ivermectin in the prophylaxis of COVID-19. There's a large amount of data available on the effectiveness of ivermectin in the prophylaxis of COVID-19. However, most of this data is in vitro and observational studies. That means the mechanism of how ivermectin works on people has not been adequately proved. I will put forward to you though some observational data. This data seems to be quite convincing, and I will put links to this data down in the description below, so please do check it out later. One of the great proponents for the use of ivermectin both in the prophylaxis and treatment of COVID-19 is the FLCCC group, the Frontline Critical COVID-19 Care Alliance group. This is a group of highly specialized doctors from all around the world who treat COVID-19 patients right from ground zero. They maintain that the anti-inflammatory and antiviral properties of ivermectin are very effective in the prophylaxis and treatment of COVID-19. I would like to especially point to you a couple of studies, the first one of which was done in Egypt. A huge chunk of population of Egypt was given ivermectin as prophylaxis, and it was found to be 87% more effective in preventing COVID-19 than the placebo. Similarly, a study done by the All India Medical Institutes of Medical Sciences, Bhubaneswar, had done a study wherein they gave 2 doses of prophylactic ivermectin, and they found it 73% more effective in preventing COVID-19. I'm putting forth a group of meta-analysis done for the effectiveness of ivermectin in the prophylaxis and treatment as well of COVID-19. This is a group of 56 meta-analysis currently ongoing. I've got a link for this resource down in the description. I would like to bring your attention to this chart. Although it might be a little bit difficult to understand, please do pay attention to the green dots on the chart and their relative position to the center. The green dots on the left side of the median indicate the effectiveness of ivermectin both in the prophylaxis and early treatment of COVID-19. Before we go into my personal opinion on ivermectin, let us look at some of the cons of ivermectin. The main cons of ivermectin could be some of the side effects. They include things like skin rash, vomiting, diarrhea, dizziness, and in extreme cases, liver damage. It also cannot be used during vaccinations for tuberculosis and cholera. The side effects I have mentioned, you have to remember, are transient and not permanent. My opinion on ivermectin is that it is a drug which has been widely used for the last 30 years. There have been so far 4 billion doses of ivermectin administered, and it has been a very well researched drug, albeit as an anti-parasitic. Its role against the SARS-CoV-2 is yet to be proven concretely. It is also very cheap and readily available. The side effects of this drug are negligible. So according to me, you have nothing to lose if you use ivermectin prophylactically. It may be effective, it may not be effective. Treat it like a spray and pray drug. You have nothing to lose if you use ivermectin prophylactically. So what is the recommended dosage for ivermectin? I come across a lot of different dosages recommended by different doctors. So for me personally, I would use 0.2 mg per kilogram body weight on day 1. And then after 72 hours, I would repeat this dose with another 0.2 mg per kg. So that means for a person who is around 70 kilos, I would take 12 milligrams of ivermectin today and another 12 milligrams after 72 hours. Then I would repeat this same 12 milligrams once a month. But please do contact your doctor to get his opinion. It is not fair to take prescriptions from the internet. Remember though, ivermectin is not a replacement for vaccinations. Think of it as an additional aid in prevention of COVID-19. I hope through this video I provided you with some value, and if I did, like, subscribe. I'll be seeing you in the next one. Signing out, Dr. Rohan Fonseca.